Eval Health is an app platform for clinicians and researchers to create, share, and deploy clinical apps. To learn more, meet us at eval.health and click Learn.
This is Jennifer Glenn, Chief Medical Officer with Eval. The healthcare team faces a lot of challenges to get the job done. An overarching theme in these challenges are decision fatigue, disconnect, and the tools to do something about it. I want to showcase an example of how building and sharing apps as a form of publication can make a difference in your own practice and give you the tools to impact practice of your team, organization, and beyond. And no doubt we have access to a lot of information: conferences, journal publications, continuing medical information and education, even surfing the web for the latest decision tool. It's challenging to digest guidelines and curate the best practice to meet the most pressing priorities in front of you. And the idea is to give your team the tools, that is anyone on the healthcare team, to translate guidelines, develop workflows, and customize care. And as a healthcare community, build a compendium of best practice apps that we can share and learn from each other. I believe it is the next step in publication and a powerful way to communicate and network around best practice. I'd like to share an example with you. One day I was going through some journal articles and I found a great article written by several physicians in the American Academy of Family Physicians on alcohol withdrawal syndrome, outpatient management. It's a great review of the literature on how to assess alcohol withdrawal syndrome and what are the best practices around what to do about it if you're seeing a patient in that outpatient setting. And this is a real problem that physicians and clinicians and nurses face when working in the primary care setting. And in this article, they discuss several assessment tools to identify the severity of alcohol withdrawal syndrome, as well as a review of best practices. And what they've done is taken the result of a common assessment tool and paired that with specific recommendations. In addition, they provide a beautiful algorithm starting with the actual assessment itself, the results of the assessment, other factors in addition to the assessment you might want to consider, and you get essentially recommendations that target different levels of withdrawal management based on the assessment and based on key risk factors. When you read an article like this, it's a great service to clinicians as it digests the latest research around how to identify and treat alcohol withdrawal syndrome in the outpatient setting. The next step is then making sure that this algorithm and these best practices are disseminated into everyday practice. And sitting in a journal article, while it's useful and helpful, clinicians can memorize this with time, it's often not followed because, again, decision fatigue, lack of time with patients, lack of a team effort in identifying patients that might be at risk and need an assessment of some sort. Creating an app around this algorithm is a great opportunity to embed this work in practice and share and collaborate it across the healthcare team, hopefully empowering and engaging others besides just one particular person in identifying and managing alcohol withdrawal syndrome. So I went ahead and took this algorithm and created an app, as you can see here. And the app begins with evidence-based assessment that's been out there for a couple decades called the Clinical Institute Withdrawal Assessment for alcohol scale, which is a 10-item questionnaire that assesses the signs, symptoms, and severity of alcohol withdrawal to guide treatment. The app begins with the 10-question assessment. Then, based on the results and additional criteria of risk factors discussed by the authors, the following recommendations are going to be displayed. This app is available for free to use on our website. Feel free to click on the Learn More tab to get a feel for what is behind this particular app and how it works and how they're tied into the recommendations as discussed by the journal article that I just shared with you. As you go through the app, you'll notice the assessment questions, so I'm going to answer a few of those to give you a feel for what that looks like. These are alcohol withdrawal symptoms. Then, based on the article that was published, there were several other risk factors that were identified that need to be considered before recommending specific types of either inpatient or outpatient management. And those questions are incorporated here, so it's an added level of decision support built on the validated assessment tool. So based on the validated assessment, based on some additional risk factors highlighted in the journal article, I'm given the score, which is 36 out of 67 points. And the algorithm, as published, recommends, based on that point spread and the risk factors that I answered, that this patient should be considered for inpatient management. Based on the article, additionally, I summarize the risk factors or criteria for inpatient management, as well as some additional management considerations that the author discussed. And this allows me the opportunity to see the evidence and make the best decision in a shared decision-making relationship with the patient. Additionally, there is a download button. I can download this into a PDF. The PDF displays a summary of the score as well as the recommendations and a listing of how all of the questions were answered. This can be copied and pasted into the EHR. It can also be printed, as you see here. I want to emphasize that this is a great opportunity for authors that are publishing to create an app that allows their work to be disseminated right at the front line of practice. And just like publishing an article, apps can have authorship and attribution as well. And we have a new feature on board now where we can make that happen. I have covered that in a series of videos called Getting Started. To get more information on how to clone an app and more features around publishing apps as well as building your brand. What I like about authorships and branding is the ability to create influence, to not only elevate your own practice, but to influence your team, your organization, and beyond. We want to build trust within the community, and in order to put out good evidence in the form of apps that are actionable, we'll need a grassroots community that is willing together to invest the time to curate the best evidence and put together apps. I hope this was helpful to you, and I'll be posting more videos on examples on how you can improve your own practice as well as influence and connect with others that are doing likewise. Thank you.